Hi, I'm Dr. Bone.
Hi, I'm Dr. Lisa Tartaglia, and we're here today to talk about the harsh realities of being in the hospital.
So this topic was brought to my attention by a resident that I was working with just not too long ago. And as we were discussing about the hospital is not as safe as what we would hope or what we think. And I talked with Dr. T about this, and we decided this is something we really need to discuss. The harsh realities of hospitalization, that it's not as safe as what you might think. You're in the hospital because you're ill, and you wind up being at extended bed rest, and that causes a lot of risk factors of its own.
Right. I love how you developed the term the royal effect. Can you tell the viewers about this?
So the royal effect is you're treated like royalty at the hospital. Everything comes to you. You don't have to go anywhere for anything, and you just push a button and someone will come and find out what your needs are. Your food comes to you, your bath is brought to you, or your help to the bath, you're gotten to the toilet with assistance, your medications, your doctor, your nurse, your therapist, everybody comes to you. And if you need to go to a test, you don't have to go there. Someone will take you.
In a wheelchair.
Yeah. So while you're in the hospital because you're ill, you're going to decline while you're there. Your strength is going to decline. Your function is going to decline while you're there because everything is being brought to you because you're being treated like royalty.
Yeah, and it's important for you to get up and move around because if not, you're at a higher risk for blood clots. You're at a high risk for functional decline when you get home, as Dr. Bone said. And also, when you're not moving around, you're not able to go to the bathroom, so you become constipated.
Yeah, so you're going to lose strength, function, you're going to get constipated, and you're going to have other issues that are going to develop from not being active.
Right. Another big thing that changes when you go to the hospital that you don't even think of is nutrition. When you go into the hospital, you're eating hospital food. So the taste is different, the quality, the timing of your meals, how much food you're getting. You know, are you that diabetic that's now going to have to eat that disgusting
They're not going to give
diet?
You what you want. Yeah,
you're not going to have any donuts.
You're on a
jelly
cardiac
donuts.
diet. You're not going to get any salt.
When is the meals getting delivered? Are you a night owl where you don't like to wake up in the morning really early? Well, your meal might be delivered at 6:30, 7 o'clock. So by the time you get around to eating it, will the temperature be off? Will it be cold? Are you going to eat cold oatmeal?
And sure, they can warm it up for you, but then it's been nuked.
Yes. And what is the amount of food? Like, are you used to having big breakfast, big lunch, small lunch? You know, all those kind of things play a part in your ability to heal and ability to eat.
So it's going to affect your appetite. You might miss a meal. You might be gone for a test. They might bring your meal and set it on your bedside table and you were asleep, maybe because of a medication, and your appetite is just off.
Yeah. Are you a denture wearer? Did you bring your dentures? Can you even eat the consistency of the food that they're bringing to you?
Can you eat in bed, laying down? I mean, that sounds nice when people bring you breakfast in bed, but what about eating every meal in bed for a couple of days or maybe for several days?
Yeah. And also, like, what liquids are they giving you? Do you have water in your room? Is the water even palatable? Can you drink it? Does it have a nice taste? Is it warm? Is it cold? Is it available? Is it even within your reach because you're stuck in bed?
So maybe they bring you those little bottles of water. Then you know it's gonna be refreshing and it's not gonna be warm water. Can you get the lid off? Okay.
Yes.
Can you get that lid off? So your fluid consumption and your food consumption is certainly going to be different in the hospital than what it was at home.
Mm-hmm. When you go in the hospital, it's normal to have some increased confusion. Some people get very anxious in the hospital. Their sleep-wake cycle is off, and people get depressed. I mean, if you're not used to being down for the count, laying in bed, some people do not like to be have the royal effect. They want to be up and doing their things.
Well, you get your nights and days mixed up.
Absolutely.
You can get disoriented. The lights are going to be weird. You know, every hospital room has to have a window. So you can see outside, but that may not be enough. You know, maybe the window that you've got doesn't really face a direction where you get good penetration of light. So your days and nights are going to get messed up the hospital has 24 hours of activity.
Right.
And they try to keep this like dimmed light at night, but the nurses have to have some light to see with. And she's going to come in and check on you, or he is going to come in and check on you in the middle of the night. So when they open that door to come in and check on you, light's going to pour into that room, and it's going to mess up your day-night cycle orientation.
Yeah, and with a 24-hour of activity, they have to give medications at night. Sometimes they're drawing blood in the middle of the night because that's when the
4 o'clock in the morning.
4 o'clock in the morning, the phlebotomist is going around to do the rounds because they have to have the phlebotomist ready for the new patients that are coming in or for procedures that are going on. So that becomes a problem. Can you even get out of bed to open up your blinds to see outside the window? Sometimes you can't even get up to turn on your lights, so it's very dark at all times. Is your bed comfortable? What's the height of your bed? How are your pillows? Do you even have pillows?
How are you dressed? Are you wearing comfortable clothes, or are you wearing one of those gowns that exposes you in the back and you're not comfortable in that type of thing?
So if you're wearing a hospital gown and you're really not comfortable in the hospital gown, are you even going to want to get up to get out of bed? If there's a chair in your room to sit down on, will you want to utilize it if your backside is out, if you don't have proper undergarments?
Yeah, what kind of chair do you have to sit in? Are you having to be in that bed 24 hours a day? And I know the beds, are mechanical and they move, but it's not like sitting in a chair or sitting in a recliner. If your family comes, they may be the ones in that chair. Is that chair comfortable for them to sit in?
Right. And what are your interactions with others become skewed because of the day and the day and night reversal? Because a lot of times, since the hospital is 24/7, at night you might be so interrupted that you're sleepy during the day.
When your family comes to visit, or maybe they can't come to visit very often because they still have
to work.
A work schedule, or traffic prevents them from being able to get here. I know in Florida, our traffic has really been bad the last few years, and it's difficult for families to be able to come and visit, so you end up spending a lot of time by yourself, and the only interaction you have is with the hospital personnel, and they are on the clock. They've got other patients they need to tend to as well.
Yeah, so they can't really spend a great deal of time interacting with you because they have a caseload themselves. And not only is traffic worse, but also hospitals have gotten worse, meaning they are filled with people. They are just filled to the max.
Sometimes patients are being boarded in the emergency department because the hospitals are full.
And there's a lot of staffing issues because of everything that has happened since COVID.
So other things that can affect your sleep-wake cycle could be medications. You might be on something for anxiety or for pain or for sleep. Sometimes even blood pressure medicines or antibiotics can kind of goof up your cycle.
Right. A lot of times when you go in the hospital, you give up personal items. And when you give up these personal items, that is your orientation system. I mean, who can live without their iPhone? Their Apple Watch, their pets. They're used to having their dog or cat come over to them, and then they're like, oh, it's dinner time. I have to feed the dog, or I have to take the dog out.
You have your own routine set up, and so when you go to the hospital, that whole routine can get kind of twisted, and you don't have the things that you usually use to orient yourself to what time it is or what day it is. I get teased at work because I have a different pair of shoes that I wear. I'm fortunate that I get to wear scrubs to work. So I'm in the same outfit every day. I change my t-shirt to a different color every day, and I have a special pair of sneakers that I wear every day, and I am teased by my coworkers because I can reorient myself by just looking down at my feet. So I have a Monday pair of sneakers, a Tuesday pair of sneakers, and I know what day it is, and my coworkers also know what day it is by looking at my shoes. They, I know what day it is because I can see Dr. Bones wearing her red sneakers today.
Right. When you're in the hospital and you don't have your normal things, it's really
you're
hard
out of your element. And then you're trying to use that TV controller.
Oh, they're so cumbersome. I mean, we kind of know what it's like to be in a hospital because in our training we had to live in the hospital when we were residents and interns. You had to stay in the hospital, so we know the pain. But we were supposed to be living off of adrenaline. We're not supposed to be resting. We're there to take care of the sick. Right. So we didn't sleep, but we did eat the food and we did stay in a hospital room. So and those TV controllers and the bed controllers are so cumbersome.
Yeah. And if it drops on the floor and you can't reach it, then you can't change a channel. Yeah. And you can't call for the nurse because you can't reach that crazy thing.
Yeah.
What if you have a roommate?
Oh, there's a lot of issues that can go on with roommates. There's so many issues. Is your roommate noisy? Is your roommate in distress?
Does the roommate answer questions for you?
Yes.
I know that sometimes I go in to see a patient and the roommate from the other side of the room is telling me either what they've observed about this patient or of something about their own health or about their friend's health that is not really related to the interaction I'm trying to have right here. So roommates bring their own dynamic if you're in a hospital that still has roommates.
Yeah, and I think roommates can really obstruct boundaries for the patients, when you're tired, weak, and sick, it's normal for you to be more disoriented. So the disorientation, the depression, the anxiety, you're going to see that worse. They call it institutionalized delirium patients get. After so many days in the hospital, they get very delirious. And it's going to happen to the best of us.
Well, they get agitated and they get angry. Sometimes I'll go in as a consultant and I introduce myself and I start asking them questions. And they're like, you didn't even look at my chart. You don't know what's going on. I did look at your chart. I want to hear from you. So I understand that they can get agitated and they can get angry. They're frightened, and they might forget, who did I see last? Have I met you before? It is very disorienting.
Yeah.
And
we
to
all
be
wear
in
white
that,
coats.
Yeah, everybody. And in the hospital I'm working, we're still wearing a mask.
Yeah,
How
everybody's
crazy is
masked.
that?
So nobody could see, nobody could see who they are seeing, who they've already seen, because all they can see is the eyes and the white coat.
Was that the guy? I don't know. He was wearing a mask.
Yeah.
So you spend a lot of time alone, and you get these little snippets of
socialization.
Yeah, socialization, and so they're not normal socialization, and it is very disconcerting, and so it can cause you to have even more issues.
And oftentimes when you're in the hospital, you're not seeing the physicians and your healthcare team from outpatient. You're seeing hospital. Yeah, you're seeing hospitalists and the specialists that are on call for the group, and it may not be the person you see.
So another contributing factor to hospital not being as safe as what we might like is how it affects our continence. You wouldn't think just being in the hospital, what's that got to do with my bowel and my bladder?
Oh,
a lot.
Are we drinking enough fluids? Remember that water we talked about? If it's not bottled, it can be kind of gross. So are we going to want to drink enough fluids? Are we able to get help to go to the bathroom? If we're not able to get help for the bathroom, I know myself, I would not be drinking water because I wouldn't want to go to the bathroom.
We should be emptying our bladder at least 6 times a day. That's the only way you have to flush out that segment of urethra and help keep it clean so that we don't get a bladder infection is by voiding. And so you want to make sure that you're going to the bathroom often. Now, if you're taking a medication that maybe makes you get rid of water more, you may have to go to the bathroom even more often than that, and you may not be able to control it. If you've got an infection, it may be making you leak urine, and that may be undesirable. So you think, well, I just have to worry about getting wet. Well, what if sometimes the medications make you not be able to empty your bladder? So you actually have urinary retention and you feel like my bladder is really full and I can't empty my bladder.
Yeah, and it can be very painful.
So you've got bladder issues for continence and you might have bowel issues. What if you've got stool problems because the medicine they gave you for the antibiotic to clear up the infection is now giving you diarrhea? And maybe you can't control it, or the medicine that they give you to relieve your pain has made you constipated, so you can't go. So now you're off on your bowel and your bladder cycle.
Another big thing that you have to worry about when you're in the hospital is falls. It happens to the best of us. There's medications that can contribute to the fall. You can be dizzy. You're just drowsy because remember we talked about the day-night sleep cycle being off because the hospital is a 24/7 operation.
Or you're weak.
Yeah.
Your blood pressure's low. They gave you medicine to pull off extra fluid, or they changed your blood pressure medicine, and now your blood pressure's low.
You could have a lot of pain that might make you not ambulate properly because you're favoring one side or the other. That may make you fall. You could be stiff. You have degenerative joint disease. You're already stiff to begin with. You have history of a stroke per se. So you might have contractures or atrophy, like not very good musculature in place from that stroke.
You can't fully extend your legs. Maybe you got a muscle cramp. Maybe you've got a, like she said, a contracture to where you can't fully extend your leg or your arm, and you can't balance yourself as well.
Yeah, there's so many obstacles in place for these poor patients that are in the hospital. There's IVs, they're connected, they could be connected to a heart monitor. So there's different, different electrodes on you that you get under your gown and or in your leg, depending on how you're sitting.
And you got to carry this little box around that's in the pouch in the front of your gown.
And it's heavy, so that can weigh you down.
You got IVs. You got oxygen tubing. You might have a little monitor on your finger for oxygen. You might have the oxygen cannula in your nose.
You have your booties.
Yeah. Those slippers with the little sticky things on the bottom of them to try to keep you from slipping. And I don't know if you've worn those things, but I don't think they're very soft or cushy feeling. They're kind of cheap and inexpensive, and they're just have those little rubber things, but they're not really comfortable on your feet. So you've got obstacles that you're trying to get around. Maybe you got a mask that you have to sleep with at night. And then sometimes people, when they're in bed, they're worried about their heels being pressed too firmly in the bed. So at night they'll put these big boots on. It's basically like a pillow strapped to your foot and your ankle, and they call them POTUS boots.
Yep.
If you get up in the middle of the night because you got a leg cramp or you got to go to the bathroom, and you get up and you got that great big pillow on there,
that's gonna fall.
You don't remember that thing is on there, except you got this great big pillow strapped to your leg, and by the time you realize it, you may already be down.
Yeah. And then there's devices that they use that are compression devices that are really like these large apparatuses that go on your calf to prevent blood clots. And they are a pain in the neck because you have to disconnect them, and you will forget. Unvelcro them. And if you forget, you will fall because you're connected to the machine at the end of your bed. And
I think it's like a big milking machine that fits on your foot and on your ankle. And so it sequentially squeezes your foot, then your ankle, then your lower leg, and then it releases, and then it starts squeezing again to kind of milk that blood up from your lower leg. How do you sleep with that thing on there? Yeah. I know they're trying to keep me from getting a blood clot in my leg by putting that thing on me, but I don't know how I'm going to sleep with a milking machine on each lower leg.
I know.
Then how am I going to get up out of bed without it?
No. And if you have to go to the bathroom quickly, you're going to do it yourself because it takes forever when you call the nurse or the aide, because they could be attending to other patients.
And I don't want a bedpan.
No.
That's not my preference.
No. And again, like we talked about lighting and the bed height, that plays a big role in falling, because if the bed is up high, because maybe a nurse was coming in to do a procedure and she moved the height of the bed high, you could fall out of the bed easier because you can't. I'm short. I would not be able to touch the ground. Or the lighting, if the lighting is not good, you will fall.
So let's talk a little bit about another big potential for errors, and that's going to be your medications and your tests and your procedures that can cause an error. So this is not a comprehensive list, but just to talk about a few things that are points for errors. I think for me the big one is the EMR, the EHR, the electronic health record that every person in the hospital, I don't know about the janitor, but it seems like everybody is in that computer system all the time. They're always cursing it. They're always pecking on the computer, but it's a necessary evil. We have come a long way from paper and pen to get to this electronic medical record, and it's supposed to help prevent errors. People are clicking boxes. They can get in your chart. Multiple people can access your chart all at the same time. However, sometimes those safety measures can also cause errors, and it can slow things down.
Right. Pharmacies, there's like a lot of stipulations to protect your chart from places of error, but with pharmacy error, you can get an error with medications. Oftentimes, you may be confused because you're taking medication that's on their formulary, and maybe you were on a different type of medication. You might have a side effect to that medication. You may not have been able to tolerate that medication at home, and now they're giving it to you there, and it can be an error.
Just to give a list of them, it might be the wrong drug, the wrong dose, the wrong time, I mean the wrong person, an allergy, something that you're allergic to, like Dr. T said, or maybe a side effect, maybe it's a test that they did and it's the wrong test. You know, you always hear about the wrong surgery. Those don't happen very often, so that they're very notorious when the wrong surgery is done. Maybe they should have ordered a test or a surgery or a procedure or a med, and they failed to order that.
Yeah.
What they ordered was a nice gesture, but maybe it was wrong. Maybe it was unnecessary. And tests and meds and procedures all have risks associated with them. And so if they order something, even though they're well-meaning, if you didn't need it, they exposed a person to something that they didn't need.
Right, and diagnosis error is it's a huge error. It doesn't happen that often, but it can be detrimental to the patient. We also find patients get discharged too soon, or the opposite. They're kept in the hospital way too long.
Too long. I cared for a patient that went to the hospital like on a end part of a week and had a surgical procedure done that was elective, and they ended up having a little perioperative little mini stroke. And so day one post-op, they still had a lot of pain and they had a little bit of memory impairment from this procedure, from the anesthesia. And so they kept them over the weekend because the individual was having pain and they lived alone at home and they had been independent. They actually drove themselves to the hospital. And they had an injury over the weekend from a fall, and they ended up needing to be there that next entire week. And then they started not eating, and they started having more decline. And after being in the hospital for 6 weeks, our palliative team was consulted. And this individual just progressed to decline because they were totally out of their element, out of their routine, and they just kept having little insult after little insult. They had a little TIA, then they had a little fall, then they had another little mini stroke. And all of this dated back to that original hospitalization. And you just worry about that. Should we have done that elective procedure to begin with?
That's why it's really important to have a good relationship with your healthcare team and to have open goals of care discussions, physicians who are listening.
Have the support of your family and have them involved in the care.
Absolutely. Another problem that occurs in the hospital is language. Like language problems can occur, meaning, you know, is the staff speaking too softly? Are they speaking too loud? What's their accent? Is the patient English speaking? You know, do they need somebody that's non-English speaking? Are they Spanish speaking? Are they Haitian? Also, medical jargon. Like oftentimes, you know, patients will just shake their head because they can't hear. Their hearing aids are at home.
Or they don't understand
and they don't
jargon.
understand the jargon.
So it's a speaking and listening, and we each have to do our share. The physician has to speak and has to listen, and the patient has to speak and has to listen. They have to hear what's being said, and they have to process it. And the physicians aren't trying to be rude when they ask you to clarify or verify that you understood what they're saying. They just want to make sure they're making themselves clear. And by the same token, you need to tell them, I don't understand that. You need to explain that to me in a different way.
Exactly. And it's really important to have those conversations because you don't get a lot of time with the physician in the hospital because they're making rounds. So make sure that you're getting your questions answered. If you have hearing aids, hopefully your loved ones can bring them in so you can hear better. And hopefully, even with the masks, it's hard to understand people because the enunciation is different now with the COVID masks.
So being in the hospital, another whole area of concern that we have is hospital-acquired infections or hospital-acquired wounds. And I'm not talking about like a surgical wound when I'm talking about that, or an infection that, you know, was anticipated, but something that we try to prevent. So bacterial infections, viral infections, fungal infections, all of those could occur in the hospital while you're there. It's an increased risk for elderly, somebody that's got a weakened immune system, anybody with a serious illness, whether it's a heart problem, a lung problem, a kidney problem, a liver disease. So if they're at risk, they could get an infection much easier. And you may not think about it, but any kind of medical device is puts you at a higher risk.
like a pacemaker. People have stents, pacemaker, IVs, catheters, ventilators, all these things, and prosthetic devices and prosthetic joints. All these things are a source of infection. It's like a foreign body in your body, and bacteria
act like it's a magnet.
Viral
They
and
look
fungus
for it.
love it.
So if you've got, a gallbladder problem or a kidney problem and they have to put in a drain, those drains are really hard to keep bacteria out. You are just at a higher risk being there. You can not be, clearing your lungs, breathing deeply, coughing, so you're increased risk for a lung infection. We've already talked about eating in bed.
Yeah.
Do you swallow stuff right? Did you aspirate something? So deep breathing, an intermittent cough. I used to tell patients every time a commercial comes on, take a deep breath or have a cough. You've got to keep your lungs healthy as well while you're there at the hospital.
Right. If you have a current infection of MRSA, or you've had prior infection of MRSA, these kind of things put you at high risk for more infections.
MRSA is a bacteria that is really prevalent in hospitals right now. It's methicillin-resistant Staph aureus, and it's a bacteria that we should be able to kind of cohabitate with or control on our own. But if we have a medical problem that impairs our immune system and our immune strength is weakened, then we're at a higher risk for that MRSA, for that MRSA, to become an acute infection.
Yeah. And patients that have been recently hospitalized or institutionalized in the last 6 months, they're at a higher risk of infection because they are weak. Their immune system is weak. Everything's weak. So
and living in a communal area, if you live in a nursing home, assisted living, an independent living situation, you're at higher risk than somebody who lives in a private home. If it's an individual that's incarcerated in a prison system or in a jail system, they're at a higher risk. We know kids who live in college dorms are at a higher risk, but usually they're young and they're vigorous and they have a great immune system, so they can get infections, but usually their immune system is such that they're able to fight that off.
Right.
Others that might be at risk is just by age. If they're over the age of 70, they're at an increased risk for an infection.
Right. Recent surgeries put you at increased risk of infection. If you had a recent surgery, heart surgery, lung surgery, abdominal surgery, or joint surgery, this is all part of the risk factor. So make sure you know what you're signing up for when you sign up for these elective surgeries.
And orthopedists, I'm telling you, those guys are beasts about making sure my joint is kept clean, my surgical wound is kept clean. Some medications can actually increase your risk for infection because they may reduce your ability to fight off infection. Now, certainly, steroids might decrease your ability to fight off infections, but there are some infections, viral infections maybe, that a steroid might be appropriate. Sometimes those PPIs that you use for reducing risk for an ulcer, a stress ulcer in a hospitalized patient, might actually decrease their ability to fight off an infection.
So it weakens their immune system. So you have to look at the whole patient.
Wounds can place you at risk. We talked about the surgical wound, but sometimes being in bed, you can get a little sore somewhere. You can get a little sore on your backside, on your bottom, maybe on your heel or an ankle, depending on how you rest in that bed. Or maybe you were trying to get out of bed and you bumped your elbow and now you got a skin tear, or you've got an abrasion on your ankle or on your foot. You need to bring that to the attention of your healthcare team so that they know that now there's an open place in the skin, because your skin being closed is one of the best barriers you have to infection. And we do have a video on skin and how that relates to serious illness that we can link that below if you want to watch our skin and serious illness video. Yeah,
and patients that have wounds or pressure sores or bed sores, they should have a specialty bed even while in the hospital, and that will decrease the risk of them worsening.
However, it can contribute to a fall because they can't get out of the bed.
Exactly. So you have to just make sure that you're repositioning your patient to try to prevent the wounds.
So if all goes well during your hospitalization, which we hope, and now it's time for discharge, they've got to look at that because the discharge process also has risks. Now it's time to go home. Yay, you are stable and you don't need that close monitoring for your acute situation, but it doesn't mean that you're out of danger completely. You are better, but you may not be well. You may not be returning to home in the same condition that you came to the hospital in. It's likely that when you're ready to go home, you won't be at your prior baseline.
Yeah, and that being said, you may not be going to your actual home.
You could still be weak and still be frail, and you might be so weak or frail that they say you can't return to your prior living situation. So we need for you to be evaluated, maybe for rehab or a different living situation, maybe for a short period of time, hopefully, that you can get stronger before you go back to your primary residence.
A lot of patients need physical therapy, occupational therapy, and some will need speech therapy upon discharge from home. So it's really important to make sure that all of that is in place. It's just not as simple as, okay, I'm going to go home.
They've got to evaluate your ability to take in food and fluid and get your oral medications. Can you obtain your medications? Are you going to be able to manage your pain, manage your bowels, manage your bladder? And get all of those services coordinated. Do you need durable medical equipment before you go home? That's got to be coordinated, and it may be necessary to be in the home before you ever leave the hospital. If you're on supplemental oxygen, you're not going home till that's there.
Right. And durable medical equipments like the supplemental oxygen, the wheelchair, the walker, bedside commode, table, that's what we're talking about.
So if you're just like emphatic, I've got to get out of here, I've got to get home, and the doctor's hesitant or maybe your family's hesitant, you still have time. You've got up to 30 days to make your decision that no, home was not the right place for me. I do need some rehab, even if it's just for a week. I'm not getting enough help out of having physical therapy come twice a week and occupational therapy come twice a week. I need more intense than that. I need to go to geriatric boot camp. I need to go to a rehab facility so I can really work hard and try to regain my strength, even if it's just for a week or 10 days. You have a little bit of time to make that decision. So if you're desperate, I got to get out of here, they'll let you go, but you've got to have all those follow-up arrangements. You are supposed to see your primary care within 72 hours of discharge. So if you get discharged on Friday, that means Monday morning you're supposed to have yourself in with your primary care to follow up.
Yeah, and you need to have support and assistance of your friends and family to help you. You have to also, to go back to the primary care, please bring your discharge paperwork and obtain it before you leave.
Your discharge paperwork is supposed to contain a lot of information, so it's going to be a full packet. It should tell you the reason that you were hospitalized. They should include all of the major tests that you had, ideally with the results of those major tests, and it should tell you the reason for your medical diagnoses. It should have all that stuff contained in there. They should also give you advice as far as your diet, your activity. It should be
wound care,
plainly written out for you. Your wound care instructions, your medication instructions, and they should tell the dates of your follow-up. Not just your primary care, but also the specialists that you're supposed to be able that you're supposed to follow up with. And they almost always contain a little disclaimer there of when you're supposed to come back to the emergency department.
Yes.
What those parameters are.
What are those parameters to come back? Like if you're having chest pain or high fever, things of that nature.
When to call the doctor.
When to call the doctor.
Some things that you can do to help yourself and help your physician, to help you stay on track, to help keep you from getting more ill while you're in the hospital, and help prevent any errors, help the hospital make your stay more safe.
Right. A calendar and a clock is a really big thing. I recently had a family member in the hospital and the clock was off by an hour, and you don't realize even just by having a clock off by 1 hour what that does to a person, but it can drive you crazy if you are you're taking medications in a timely fashion. So it's good to have a good calendar, a clock. If you want to have your phone and you're alert enough to have it, because sometimes phones can be stolen from the hospital, make sure you have your chargers, make sure you have your watch. Get up. It is so important to get up and move around, even if you're not eating or drinking. If you're like in an NPO because you're about to have surgery, you still should be getting up and moving around. Develop a routine a daily routine while in the hospital.
Don't succumb to allowing yourself to completely be treated like royalty.
Yes.
Move around. Do some things for yourself, even if you're just walking across the room. Ask them, am I allowed to leave my room and walk around the hallway? Because you're not getting any exercise. And some people say for every day you spend in the hospital, you're going to need 2 to 3 days for rehab, up to 5 days.
Up to 5 days, depending on how debilitated you were going in. You want to keep a log or a diary if that's your thing. That might help you stay on track. Talk to people. If you have a phone, make sure you're talking to others to try to share information with family and friends to kind of keep you on point, because you're the one that's in the hospital and you have an increased risk of having just hospital delirium because you're out of your element. Ask a lot of questions. Confirm your understanding. Don't worry, about taboo topics and whether you're going to jinx yourself. That's not that. You need to know what are the what ifs. This is your body. You have the choice. It is not up to the physician and the nurse to make the decision. Make sure you stay on topic and you know what you're in for.
Yeah, I know they're going to be interested in a lot of information that you have, but remember everybody's time constraints, and so you're going to want to share the important information. And sometimes you're not sure if this is important or not, so offer that information. And if they want to have more information on it, then you can go into a lot of the detail about what happened or how you got to where you are, but do stay on topic for them. You can help yourself by having your hearing aids, having your glasses. If you have dentures, I encourage you to have your dentures so you can eat and drink. Then make sure you get up and you go to the bathroom, you pee and you poop, and you keep your regular cycle as best you possibly can.
And if it does go awry, please let the team know. Don't wait 5 days without a bowel movement, because the ramifications of that, and then the
you
medication.
May sound like that's it. I don't need to worry about that. Yes,
you
do.
do. Yes, it's really important.
We want to manage your pain, but you have to realize you're in the hospital for a reason. And so elimination of pain is not likely when you are so seriously ill. But we do want to manage your pain so that you can get up, eat, drink, pee, and poop. We want to manage your pain as best we can without zonking you or putting you at risk for other problems.
Safety is a big thing in the hospital. We want to make sure that we don't cause any more injuries. So make sure you use the call button if you can't get up. If you have slippers or shoes, please put them on before getting up. Another big thing is hand washing, hand sanitizer. And make sure, like during the day, open your window shades so you know it's daytime, so you can try to help yourself.
Try to keep your regular schedule. We really appreciate you watching today, and I know this was long and kind of rapid fire, but the hospital is not always as safe as what we want it, and we want you to have a good experience if you need to be in the hospital. But the harsh reality is sometimes bad things happen at the hospital. So being there, sometimes that puts you at risk, and you need to do your part to keep yourself safe.
Thank you so much for joining us, and have a wonderful day. Bye now.